everybody kind of gets into governor this, governor that. I just happen to have this job, and there's some things that I can do. And it's great that I've got people around who want me to do this. First of all, Greg Moody, the Office of Health Transformation, has done a fantastic job. And John McCarthy, God bless him, moved here from Washington, D.C. And these guys, along with the whole team, it's Tracy Plow and John Martin and Michael Colbert, you know, we are now putting things together so that we can have a solid plan for excellence. And they have convinced me pretty much, and this is pretty stunning, that we can actually have better health care at lower prices. If we put the system together, if we make the system work appropriately, we can have fantastic results. Last week, some of you from the press were up at Dave Blum's operation in Ohio Health, and what a great day it was, employment first, so that mothers and fathers with disabled children are going to have an opportunity to have those children use their gifts, their God-given gifts. We know there are shelter workshops, we think they're important, but some people should be in different settings, like the hospital, or like Kroger's, or like the Home Depot, where they can work and earn more money and feel better about themselves. I mean, it was, as I said, it was like a bright light breaking through the clouds, and to just see those moms and dads there and see how proud they were of their adult children. You know, you can't, that's why I do this job. I mean, it's so fantastic. So now we have these children's hospitals. Isn't this just fantastic, all of them? I mean, we have the best children's hospital individually in the country. They can compete with one another, but it's our own elite, well, it's our elite six, okay? But you know what's so amazing here? They're not competing against one another. They're working together. I mean, give Gordon Gee a lot of credit for getting the universities to work together on the Capitol bill. These folks can be leaders in terms of what we can do with medicine in Ohio. As you know, we have an organization, an entity that we're trying to build called the Medical Corridor, which would involve the Cleveland Clinic and Case and University Hospital and Ohio State and Dayton and Cincinnati, the children's hospitals, and of course a number of the private health entities, that if we can get them to work together, the kind of exponential benefit, I think, is something we can only be really excited about. Dr. Gabby, the head of the health center up at Ohio State, is making all the efforts to bring people together, and he's starting to get good results. Our Ohio First, gentlemen, the opportunity for Ohio medical device inventors to be able to get a look. I think we call it Ohio First. You know, if we've got brilliant people in Ohio, give them a chance to show what they've done. You don't have to buy, but give them a look. The ability to work together on imaging, the ability to work together on clinical trials, and to find out where each one's sweet spot is. By getting the adult hospitals to do what these children's hospitals in a more aggressive way can only yield really great things. Dr. Bernard, he is the man that really got everybody together. Some said that what I did a year ago was impulsive, okay? I really don't do much that's impulsive. I pretty well know exactly what I want to do. I found out the challenges of the children's hospitals in a personal way. And I found out at the time that the children's hospitals were not getting their fair share of research dollars through the graduate medical education. And I went to work when I was in Washington with some of my friends, including Dave Hobson and members of the Appropriations Committee, to carve out a bigger chunk of money for the children's hospitals. Frankly, it ought to be a given in the budget each year, and it is not. It's a constant fight. And you know, for 140, 150, is that what the round numbers are for this thing, Nick? That's how much they leave on the floor at night at the Pentagon. And there should not be any debate about 150 million extra bucks for our children's hospitals around the country. But it's a fight, and somebody's got to stand up for our children and make them the highest priority. Well, when I went to Columbus Children and I walked into this research area at the Children's Hospital, and I was able to look at the material that they were storing in their banks, so that this material that was related to the diagnosis of disease could be shared throughout all of America, throughout all of the world. The best practices that you can use to treat our children, of course, made me excited. And the idea of creating some sort of a program where we could give them an incentive. And look, $2 million, you know, it's not enough. But I guess we go back to the thought that counts, you know, and frankly, the $2 million, as they said, it's a good start. And we've never done this in Ohio before to try to push research, and particularly in our children's hospitals. There will be $1 million that will go into joint research among all of our children's hospitals statewide for asthma. Now, asthma is a terrible, terrible condition that we think can be improved through research. It affects our children, it affects our adults, it affects people in this room, doesn't it? And there are ways in which we can begin to lessen the impact of a condition like asthma. And, you know, asthma can be serious enough where people can die from the fact that they really just can't breathe. And when you think about the complications from asthma, which leads to many other diseases, you know why it is a critical area for us to work. Does that get me into medical school? Okay. Secondly, you're not allowed to have fun with this now, but I have to, despite what they say about me. The other thing that we're working on is we're trying to figure out what we do for these babies that are born addicted to drugs. You know, I always knew we had a war on drugs and we had a problem with drugs, but I have never really understood the tsunami that is affecting our entire country. I was doing an interview with somebody here in Columbus the other day, and they said, oh, well, that prescription drug abuse, that's down in southern Ohio. So we have it wrong. It's right next door to where you live. And all these drugs that are wiping out our adults and some of our children, it truly is a war. The Highway Patrol is stepping up their efforts. In our administration, we're beginning to focus on more aggressive attacks that we can lead on this prescription drug abuse, including what we can do to train people at the medical schools, make more pharmacology training. Greg and John McCarthy are working on this. But think about this. We've been unable to win this war. And the casualties, the victims, are our children being born with addictions that come from people who are addicted. And so this is an effort to spend some money to figure out what we can do to offer the best treatment, to allow these children to be able to have a normal life, to be able to have as good a life as they can possibly have. So, you know, what a great thing, right? I mean, can you imagine I get to say we can have $2 million and they can spend it on asthma and helping these rainbow babies? I mean, come on, this is great. Thank you, Lord, for giving me a chance to do it. I got one of my favorite people here, Gracie, right here. And we also, Gracie is going to turn 4 in April. She gave me the rock. You know, it's just great to have these kids here and the families here, and they're going to speak. But doctors and presidents of our children's hospitals, your work is fantastic. And it's the least that I can do to say thank you for, you know, it's a little gift from 11.5 million Ohioans that really want to encourage you to put our children first and try to keep helping you each year, okay? We'll do the best that we can do, and as the sun comes up in Ohio, it gives us a better and better chance to do more and more good things to lift our children and our families in the state.